Have you recently been diagnosed with repetitive strain injury? Or do you suspect you have it? Hello, I'm Deborah Quilter. I've written 2 books about repetitive strain injury, and I'm going to tell you 12 things that nobody tells you about RSI. Things I wish someone had told me when I was initially injured. This information would have helped my RSI not get worse, so I'm going to share it with you. Number 1. In the beginning, the episodes of pain, soreness, tingling, or other symptoms come and go, so you might feel like you're completely healed. But then these episodes may occur more and more frequently until they stop going away altogether. Now you have chronic symptoms. Number 2, there is no quick fix for repetitive strain injury. Be very careful about trying quick fixes advertised on the internet, such as doing push-ups, stretches, wrist curls, or using hand exercising gadgets. These suggestions can make repetitive strain injury considerably worse. Be sure you take medical advice from professionals who truly understand repetitive strain injury, and not every professional does, so you may have to keep looking. Soft tissue injuries heal very slowly, and even when you get better from a relapse, you don't go back to where you were before RSI. You lose your previous level of endurance, so you can do less than you did before you were injured without risking re-injury. And now it's very easy to have your symptoms flare up or backslide when you overdo it. The good news is that you eventually learn how much you can do on a given day, and if you manage to stick with that, you can avoid having so many flare-ups. Number 3, treatments are not cures. They can help you feel better and gain and maintain progress, but they do not make RSI go away completely, unless you are extremely lucky and get treatment when symptoms are extremely mild. But at that point, most people don't realize they are injured. And because the episodes of RSI are episodic in the beginning, the injury will remain under the surface, and it's easy to have flare-ups and relapses because the damaged tissue is so fragile and prone to re-injury. The only cure for RSI is prevention. Number 4, RSI affects far more than the activity that injured you in the first place. For instance, if you were injured using a computer or phone, RSI will later impact more than just using those devices. It might be difficult for you to open doors, wash your hair, brush your teeth, drive a car, press an elevator button, and many other daily activities. Number 5, RSI can get worse even when you're doing all the right things because you can't stop using your hands in daily life. You still need to carry groceries, cook, drive, and use technological devices even if your hands are injured. That's why you have to be extremely careful with every hand activity. It takes a while, but most people figure out ways to reduce strain, either with adaptive devices or avoiding certain activities altogether. Your initial injury can often lead to injuries elsewhere because of substitution and compensatory use of the hand. These are very common. They happen because now you are using your body differently to avoid pain or symptoms in one area, and that leads to strain and injury elsewhere. Number 6, although it is important to have the best ergonomic setup possible to prevent strain, ergonomics cannot cure or even prevent repetitive strain injury because it doesn't take into account other important risk factors such as poor posture, faulty technique, and inherently dangerous tool design that forces you into awkward positions. Nor does it take into account the sheer amount of time that you use your hands with various input devices, such as computer keyboards, mice, and smartphones. Plus, sitting is a big risk factor for repetitive strain injury, all by itself. Furthermore, many ergonomic devices are designed to make things more comfortable so that you can stay at the activity longer, which just allows more overuse of damaged tissues and more risk for re-injury. Number 7, you will need regular physical therapy and a regular home exercise program to achieve and maintain progress. This can go on for many years. Number 8, you will have good days and bad days. Some days your RSI won't bother you as much, and other days you will feel like you're going backward. This is normal. The good news is that eventually you will learn to have more good days than bad days by adjusting how you use your hands. Number 9, repetitive strain injury will make it difficult for you to find a job. Many people tell me that even if their employer knew they had repetitive strain injury when they were hired, they simply can't keep up with the pace of work that's expected of them, even with accommodations. It will be easier for you to maintain in the job force if you work for yourself, because then you're in control. You can take necessary breaks whenever you need them, and you can stop completely for the day if your symptoms are flaring up, so you don't get worse tomorrow. Number 10, this might be difficult for you, but it's important to get the help you need so you don't strain yourself and relapse or flare your symptoms. Number 11, other people may not understand how difficult things are for you. They may think it's all in your head, or that you're just trying to get out of work. They may suggest remedies that you have already tried or know will make things worse for you by causing further strain and injury, such as doing strengthening exercises because you are weak. They may ask you why you don't get the surgery, even though there is no surgery for what you have. Nobody wants a cure for RSI more than you do, and you are probably doing everything you can to help yourself. They don't understand what it's like to have RSI, so it's best to tell them that you have a chronic injury, that there isn't a cure for, and that you are following the protocol that your doctor prescribed in order not to make it worse. Number 12, having a disability can bring on many emotions. For one thing, your anxiety can go through the roof because you lost your job. How are you going to pay your bills without your income? Maybe you can't find a doctor to treat you, or the doctor gives you the wrong treatment, or you have to wait forever because workers' compensation won't approve it. Or maybe workers' compensation will only give you a limited number of physical therapy sessions. You may feel loss because you had to give up hobbies and activities that you've loved in the past, but now would lead to a serious relapse of your injuries. You also might be angry, resentful, or depressed. Many people with RSI go through emotional ups and downs, so you're definitely not alone. You may sense that others are tired of hearing you complain about your problems, so it's really helpful to have an understanding friend or a psychotherapist that you can discuss your emotions openly with. I know firsthand from hundreds of conversations with injured people that having RSI is not a walk on the beach, but it's also possible to get better through proper care and even be a happy person despite repetitive strain injury. If you want to share your experiences, drop your thoughts in the comments below. And for more great information about repetitive strain injury, watch the video that's coming up next or linked in the description below.